Well, welcome everybody to this afternoon's webinar. We are live now with the Sapphire Education. We're just going to wait a couple more minutes for everybody to join us, because I know we've got quite a few that are really interested in today's webinar all around CBD. It's always a topic that piques people's interest. So we are really delighted to have Professor Saoirse O'Sullivan with us. So as I say, we're just going to do a little bit of housekeeping, a few housekeeping duties before we actually start on today's webinar. So first of all, we do invite you to ask questions throughout this webinar. It's a discussion that myself and Saoirse will be having around CBD. So please feel free to put the questions into the chat box or the Q&A box, and I can feed those into the conversation as we move through. We'll be discussing the topic of CBD in all sorts of different areas for around about sort of 45-50 minutes. And there will be the recording available after today's session as well on the Sapphire YouTube channel and on their website. So you'll be able to catch up with anything that you've missed there. I would also just like to put at the top of this webinar a disclaimer that we're not providing any personal medical advice during today's session, or indeed any of the previous or the upcoming sessions that we've got with Sapphire Education. So please always consult with your medical healthcare professional if you have specific questions around conditions or dosing or medications in this phytocannabinoid area. So I think what we will get doing is just remind ourselves that we've been running these webinars now for the last 3 or 4 months. We've had some fantastic conversations around the areas of patients' access to medicinal cannabis research. So please do check the Sapphire Education website if you want to refresh yourself on any of the previous webinars. And of course, we have the final webinar coming up on the 17th of March with Dr. Wendy Holden. But today, I would really like to give warm welcome to our guest, who is going to be discussing, as I say, whole host of areas around the area of CBD, and maybe we'll get a chance to dive into some of the other phytocannabinoids as well. So I'm going to introduce Professor Saoirse O'Sullivan, who is an absolute wealth of knowledge around CBD and phytocannabinoid medicine in general. So very briefly, before I ask Saoirse to really, introduce herself, because of course she knows her career and research the best, but just to let everybody know that Saoirse worked for over 20 years at the University of Nottingham all around phytocannabinoid research. So I say she has a real wealth of information, and now works as the director of the preclinical studies with Artello Biosciences, isn't it, based in La Jolla. So what we're going to be talking about today is sort of really looking at CBD in the sort of medical or medicine setting, but really understanding what CBD is doing in the body, how it gets into our bodies, really understanding some of the preclinical side as well. So without further ado, Saoirse, I would love you to give a little introduction about yourself to everybody that's joined us, and then we can start our discussions. I can see questions coming in already, so I knew people would be interested in
That's quick.
Yeah, I know. So over to you, Saoirse.
Thank you very much, firstly, for inviting me today, but also for that very kind introduction. Yeah, it's always nice to hear yourself being described like that.
Well, we're delighted to have you on board. So.
Yeah, and I'm always delighted to talk about cannabinoids, and specifically cannabidiol. So for a very long time, I used to say that cannabidiol was my favorite cannabinoid, and thankfully now the rest of the world seems to have caught up with that. As you've mentioned, I started my cannabinoid career, not my scientific career, but my career in cannabinoid science in 2002. I moved to the University of Nottingham as a research fellow. So I did my degree and my PhD in Trinity College in Dublin, you might tell by the accent and the silly name, and then moved to the University of Nottingham in 2002 for a 3-year research project. And what attracted me to this project was that it had a really kind of swanky scientific methodology about how to look at isolated blood vessels. And the other part of the project was that looking at cannabinoids and how they affect isolated blood vessels. And I was more interested in the methodology really because I'd been doing a lot of cardiovascular research before then. But needless to say, once I kind of got into cannabinoid research, I did get hooked. And I know that the addictive properties of cannabinoids, and particularly cannabidiol, are very low, but I got into the cannabinoid research area, and it just really got me. I think it was still quite early days for a lot of work. We'd only just kind of discovered the endocannabinoid system, only about 10 or 15 years before that. Everybody was still researching THC. Everything was very new and novel, and it was a really welcoming research area. And so what started as a 3-year project actually ended up as nearly 20 years. As you mentioned, at the University of Nottingham, I did a couple of fellowships, and then I got a lectureship, and I was very lucky to move to a very clinically based department in the University of Nottingham, and got a lot of my clinical colleagues enthused in cannabinoids also. And so during the course of my 20 years, I started off doing very basic research, so very much kind of in the lab, learning about how cannabinoids work and what they might be useful for, and then kind of translated that more into, well, like, can we work in patient populations and what can we do? So I was very lucky that I had a lot of clinical colleagues working with me who were interested in getting involved in the research as well. And then I started seeing there was a real change in the cannabinoid world. So for a lot of the early days, it was not a cool area to work in, I have to say. There was a lot of people who just didn't really think that what we did was real science. It was hard getting grant money. People just didn't really believe in the concept of cannabinoids or their therapeutic potential. And they didn't really understand the endocannabinoid system and how complex it was and how involved it was in so many different body systems. So we spent a lot of time persuading people that what we did was, really important. And then really, it was only in the last kind of 5 years that I feel like there's been a massive sea change in that acceptance from the public. So there's a massive public acceptance now of cannabis-based medicines, but also within professional healthcare professionals and the scientific community. Now it's cool. Now it's more than cool. And I saw that, and I also saw the fact that there was lots of companies getting involved in cannabinoid research, trying to make medicines in this area. And I really wanted to move the dial more and get more involved in that kind of drug discovery process and trying to make licensed medicines. So, along the lines of drugs like Sativex and Epidiolex that have been proven in their indications to work. So I moved from academia, which was fantastic. And I'm delighted that I had my time there, but I moved into industry, and now I'm really working to try and just kind of make sure that science gets turned into medicines and that we can have the biggest benefit. And I just wasn't doing that quick enough in academia. So I'm really delighted with the move that I've made. I love the companies that I've worked with during the last couple of years, and especially now working with Artella Biosciences, who have a CBD product, which we can talk about. I feel like that's really making a difference. And along that journey, I've done a lot of work with CBD. So I'm very happy, hopefully, to be able to answer people's questions about anything to do with CBD, from its basic biology to its potential clinical uses.
Brilliant. I mean, well, first of all, wow, what a career so far. And as you say, I think once you get involved in cannabinoid medicine, so we're talking CBD,
yeah.
THC, here, I'm the same. You do get hooked into this. It's
yeah.
really an area.
There was no leaving it. There was no leaving.
no, there's not.
All I did was gather people as I went. So I felt, this like Rolling Stone thing. So I was kind of, an individual when I moved to Derby doing this research, and I just kind of gathered people in. It was like, come join the cannabinoid revolution.
Absolutely. Well, revolution, that's right, the community, building
yeah.
that side. And I agree with you, I've certainly seen in the last really sort of couple of years as well, in particular, sort of a real take off around the interest and the more understanding as well. And I think, what you're talking about as well, doing the translational research, so really pulling out what's happening pre-clinically. So that's what we mean, when you're looking, sort of before, in sort of independent systems, you're looking before it gets into the human, and then sort of translating that into a human population. This is what we're really looking at now, isn't it? Is to try and get more medicines, licensed medicines, available for patients for different indications. So.
And the thing that's really unique about cannabis-based medicines and cannabidiol is that that's already happening in most normal kind of drug discovery arenas. You do the science, you develop the medicine, you get into humans. Whereas at the moment, we're doing the science and we're in humans, and it's actually trying to get those things linked up is actually quite hard to do retrospectively as well as, you know, prospectively. So we're getting the evidence in people, we're getting that, you know, that constant real world evidence that we need, and marrying it up with the science. So it's quite a unique drug area to work in. I don't know any other compound where it's being so broadly used, with, you know, off license or, you know, for medicinal reasons, with that, you know, not prescribed. So I think that makes it very unique.
Yeah, so I'm hoping you can all still hear me. I'm just going to pop some headphones in because apparently there's just a little bit of volume issues, so just excuse me one moment. But no, absolutely, Saoirse, I agree that there is you know, sort of a real gap, and it's a very unusual, there we go, hopefully you can all hear me now. It's a very unusual way of drug discovery. You know, I've personally have been involved in the drug discovery research pipelines as well, and yeah, it's never happened like this. So yeah, interesting times. So I think what I would really love to do is kind of sort of, you know, start as well, is that you know, we've had a couple of questions in just about some real basics. So first of all, I guess around the terminology. Already we've used cannabidiol and THC, we've used phytocannabinoids. So I wonder if you could just give us a sort of a brief basic overview of what CBD is, how it sort of compares, if you like, to THC, you know, maybe what some of the differences are, and then we can start looking at some of the differences between you know, over the counter and prescribed CBD. So let's just start with some basics around CBD then, please.
Yeah, so well, I'll start with THC really, because I guess that's probably what we've known about for the longest. It's actually probably where we have our greatest amount of literature and we know most about. THC was discovered in the 1960s, well, probably first in the 40s, but then again in the 60s. And it was really identified as being the active ingredient from cannabis. So what we mean by that is that it is the chemical that pretty much brings about most of the biological responses that are observed to cannabis. So impacts on pain, memory, movement, appetite. They're all of those impacts of cannabis that are quite well known and have therapeutic benefit in some arenas. They're mostly mediated by THC. That's the active ingredient. It's also the part that makes you high, gives you that euphoric feeling, changes your mood. That can go to some extremes like hallucinations and you know, changes in perception and altered perception. That's all coming from the THC. And THC works because it binds to a receptor in our brain called the CB1 receptor. And that's really important. This receptor is all over our brain in lots of important areas of our brain that control all of these bodily functions like movement and memory and appetite. And that's why we have such an observable response to THC. And it is the most abundant chemical in the flowering plant. So the cannabis flower of the female flower, which is where the phytochemicals come from. There's lots of different chemicals in there. We know there are hundreds of different chemicals, but the most abundant, so the one which is most common, is THC. And that's normally about 10 to 20%, depending on the type of cannabis plant, will be THC. The next most abundant chemical is called cannabidiol. So that's usually around the 1 to 2% mark, maybe even up to 5 or 10%, depending again on the type of cannabis
and
plant.
That's CBD, isn't it? So that's what that's
right. So cannabidiol is very different to THC. So it doesn't have an observable response. So if you take cannabidiol, most people wouldn't know it. So when we've done placebo-controlled studies and asked people afterwards, were you on placebo or CBD? They can't tell because there isn't an overt psychoactive effect or a kind of pronounced observable response to the drug. And that's because CBD doesn't bind to this receptor in the brain called CB1. So you don't get any of the psychotropic effects. You don't get any impacts on movement or well, maybe you do on appetite. We can come back to that. But you don't get that a typical cannabis effect or THC effect that you get with CBD. So it has a very different, what we will call pharmacological, so how it interacts with different proteins and enzymes and ion channels in the body. It's a very different profile to CBD. Although it does, to THC, sorry, it does have some overlap. So there are some biological responses that are common to both compounds. for example, their ability to have anti-inflammatory effects. They both do it, but they do it by slightly different ways. But then there are some things where they have opposing effects. So THC and CBD are very different. And the reason you can get CBD over the counter is because CBD is not a controlled or regulated substance. Only THC is, only compounds that activate that CB1 receptor in the brain and give you that high, that euphoric effect, are controlled by law, which is why you can now buy CBD over the counter in the UK, as long as it doesn't have any THC in it.
Brilliant. That's great, actually, because, I think that, it was another question about, what are the main differences between over-the-counter CBD and medically prescribed CBD? So I wonder, because, there are some products that are CBD only, like Epidiolex you mentioned, so essentially a CBD oil. So what's the difference then between that product, which can only be medically prescribed, versus being able to buy, CBD in a high street chemist, for example? What would be the differences?
Yeah. So at a very fundamental level, it's the same thing, because the chemical is the chemical, and CBD is the same. So the active part of it, which is the molecule itself, is the same. One of the massive differences, or there's two massive differences really, is how it's formulated. So in what kind of preparation do you receive that CBD, and in what kind of doses is it being delivered in? So the doses we know in the clinical world, when CBD is used as a medicine, and the only licensed medicine so far is this medicine that you've mentioned called Epidiolex, which is licensed for 3 rare forms of childhood epilepsy. That is an oral solution, and it is 98% pure CBD, so there are very little other components in there. Over-the-counter products vary quite a lot. They're mostly all oils. So because all cannabinoids, so THC, CBD, any of the phytocannabinoids, are what we call lipophilic compounds. So they are fat-loving. So they do need to be, they're very hard to solubilize, and they're hard to get into solution, which is one of the problems with them, but they can go into oils quite easily because they are themselves oily substances. So you get them in oils, but you can get them in different types of preparations where they have extracted out all of the other compounds in the plant or not. So you've heard of things called full spectrum and broad spectrum and narrow spectrum, where the plant in its flowering bud will make hundreds of chemicals. Now, if you just extract out the CBD, then you've got something which is called a narrow spectrum or a pure product. If you extract out almost everything and there's no THC in there, it's probably a broad spectrum. So there's lots of things in there, but not everything. And then full spectrum tends to mean it is everything from the plant without anything stripped out, including THC. Now, in the UK, that you shouldn't really be getting, theoretically, a full spectrum product over the counter, because that would imply that it has THC in it, which would make it a controlled substance. But so you can have lots of different types of products that contain, to various extents, all of these other chemicals other than just CBD. And then the way in which they're formulated can slightly different, but a lot of people tend to use oils. There are some kind of dry capsules that are available on the market, but I think, and they're obviously inhaled products as well. But I think in the UK, the biggest market is probably oils. Is that still true? I don't think inhaled
yes. Certainly. I mean, that's by far the most major market. So I mean, fantastic answers to these questions, and you've raised actually several areas.
So many questions.
I know that and so many areas that we want to go into. I think if we start, actually, I mean, you've talked about different products, so maybe we could talk about what we call bioavailability. How does CBD get into the body? What's the best route, the most efficacious route? So that, understanding a little bit more around maybe products and sort of what people could be considering. So bioavailability, what is it, and how does it affect CBD?
So in a nutshell, bioavailability means how much of the chemical is getting into your blood supply. So when you ingest it or inhale it or however you take it, how much of it is actually getting into your blood and therefore circulating to the cells and tissues where it needs to be to have the therapeutic effect that it needs to have. And for most drugs, we know roughly, how much of a drug we're trying to achieve within a blood in order to get a therapeutic effect. And that's how we base our dosing. That's how we know you need a gram of paracetamol or you need 500 milligrams of ibuprofen. And how a drug gets into your body is impacted by lots of different factors. So how well it's absorbed into your body. And mostly that will be depending on the site of how you take it. But for example, if you've taken it orally, it will be how well is it absorbed in your gastrointestinal system. And then it's also to do with how well is it distributed. So how easy is it for that particular drug to get into cells and tissues, and how is it broken down? So it's metabolism. So once you take most things into your body, your liver does a really good job of trying to break them down and get rid of them because it's saying, "Ooh, foreign substance, I don't want you in my body." So that breakdown of drugs and chemicals that we take into our body plays a really pretty big role in determining how much actually stays in your blood supply and for how long. And then you've also got your elimination rate. So how quickly does your body eliminate the drug through either through defecation or through elimination. Now the problem, CBD is infamous, or any cannabinoid really, it's not just CBD, anything which is a lipophilic molecule, like I said, so a fat-loving molecule has problems. Okay, they're not very druggable, they're not very good drug-like substances because they're not very well absorbed. So we don't take them in very well in our body, especially in the gut. And they'll get broken down. So because of that, I think humans have probably figured this out for quite a long time, that really the best mechanism of delivery of drugs into your system is inhalation with cannabinoids. And that's why people have been smoking cannabinoids for such a long time. The estimates are about 30 to 40% of the drug will get into your system. And that's because the lung has quite a minimal barrier to absorption with its very thin layer of cells, because it's designed to be trying to get oxygen in from the air. So, it is a minimal barrier. The gut is a much bigger barrier and it's harder to get things through, especially fatty things. So oral delivery of cannabidiol, only about 10% gets into your body. So when you take a tablet or a solution like Epidiolex, it's been shown that only 10% of that product will end up circulating in your blood system and therefore getting to your cells, your brain, your liver, wherever it is you want that drug to go. It's got to get into your blood first. And so orally, we only have about 10% bioavailability with CBD, which is quite poor, really. And most of the drug that you take, you're actually eliminating through your feces. So it's not great for a drug because you have to take quite a lot of it in order for only a small fraction of it to get into your blood supply. So mechanisms, people are looking at ways they can then try and improve that bioavailability. That's kind of the holy grail, really, I think, in the CBD world at the moment, is how can we get CBD into you better? A lot of the products that are on the counter, people talk about using sublingually. So putting it under your tongue and holding it there for as long as you can, with the idea that you might have absorption within your oral cavity of cannabinoids. And there is not a great amount of literature really proving, as in by literature, I mean scientific research, proving that that is an effective way of getting absorption. Again, because they're fatty molecules, it's hard for them to get through even in the mouth. It's hard for them to be absorbed in the mouth. So we don't have great numbers about what that bioavailability might be with by putting it sublingually or within your mouth, buccal absorption. We don't have a good idea about what the bioavailability percentage would be. And there's some idea that maybe actually most of the absorption that happens is really through the fact that you then swallow the CBD, and then it's actually oral absorption that is happening. And the reason for that is because things like feeding affects sublingual administration of cannabinoids. And we have that data best on drugs like Sativex. So Sativex is a drug that's licensed for MS, for reducing muscle tremors, and it's a 1-to-1 ratio of THC and CBD, and you spray it in your mouth. So in theory, that should be oral absorption. But Sativex its bioavailability is enhanced with feeding, and you wouldn't really have an enhancement with feeding if most of the absorption wasn't happening in your GI tract. So it is probable that even with this over-the-counter products, it's probable that most of the absorption is happening orally. So you're again looking in the kind of lower range of bioavailability.
That's really interesting, as you say. I mean, there's certainly different products around available and medical products. So it's trying to get the one that best fits yourself as the patient, obviously, for the condition and then the route of absorption. I think we've had sort of a couple of questions around.
Actually, just one thing to say about that is it's not just about how much gets into your system, it's about how quickly as well. And so we know that the GI tract, the oral absorption is quite slow, but inhalation is quite fast, but it peaks and it comes down quite quickly. So it is exactly about fitting your route of delivery and the kind of profile that you get with that pharmacokinetic response for bioavailability to the particular indication. If you have something that needs, rapid therapeutic profile, then obviously oral absorption, which takes 1 to 2 hours for you to start seeing the CBD in your blood, it is not going to be very fast, is it?
Yeah, no, absolutely. No, very, very good point. Very good point there. And, I think, you've really sort of answered one of the questions as well that's come through again about the differences between medically prescribed CBD products versus over the counter. And, what you were saying there as well is that the research, when you've got a medical product, there's the research behind it to look at dosing and levels as well as, sort of quality of product and what's contained in there. And so you have a much better understanding, or we can have a much better understanding of medically prescribed CBD, of how it's getting into the body and how it's working with that product versus using an over-the-counter product. Actually you mentioned as well around feeding, for people that are taking oral CBD and medically prescribed CBD, I guess that sort of provides a bit of comfort as well. Is there any sort of particular foods, any particular food groups that these studies have shown to enhance absorption of CBD through the oral?
So there's good data to show that feeding enhances absorption. So and the kind of the area under the curve, which is basically that peak of when is the drug appearing in your blood and how long is it staying in the blood, that exposure to drug is increased about 3 to 4-fold by feeding. So it is really worth taking your cannabinoid with a meal. Particularly, people have tended to look at fatty meals. So when you eat a fatty meal, or when you eat a meal at all, you are going to have bile salts that are going to be secreted, and that's going to help in the digestion of your cannabidiol and help in the absorption of the cannabidiol as well. So fatty foods are ones that have been probably most researched, but I think just eating in general, I think it probably is a good idea. And it also reduces the variability in the absorption of your CBD. So
Yes, no, absolutely. I mean, certainly, and as a clinician, I recommend, healthy fats, and sort of a meal. I mean, it's the same with a lot of.
I think even just drinking a glass of milk. I think there was one study that just showed a glass of milk helped absorption. Yeah, I think what we don't know is how long that lasts for. So most of the studies, they give a meal and then they give the CBD. But is there a time limit? How long does that food need to be in your stomach for? Because people don't always remember to take their medicines with their meals. So it would be good if there was some research that gave us a bit more of a flavor for what that window is. Do you have to eat within an hour and a half or an hour, or should it be immediately? Or, again, are there particular foods that could really enhance the absorption of my medicine?
And no, absolutely. And of course, the types of food that you're eating, be it fats, carbohydrates, the macronutrients that we're eating in our foods, affects what we call gastric emptying, differently as well, in terms of the time it takes for the stomach to empty into.
And that's probably one of the other, as well as the digestion of the fats, it's how long it's in your system for is really important.
Absolutely. So, but I think, we've sort of say, one of the sort of take home messages from this webinar is, take your CBD medications with food is going to be helping, but there needs to be some refinement in some of the studies to understand a little bit more behind that. So I guess, sort of moving, we've sort of talked around products and I want to come on to the differences now in terms of dosing between the medically prescribed CBD and the over-the-counter CBD products, because it's a question I always get asked, and you're the best placed person I know to answer.
I always get asked it as well. Is
two
around
questions
I always get asked. I wonder if the other one will come up.
Okay, well we'll start with this one then. And it's, why is the dosing so different between studies that look, medical trials, clinical trials that are looking at dosing of CBD, which can be 300 milligrams, 600 milligrams, 1200 milligrams of CBD plus in a dose, whereas with CBD over the counter, we're looking at 2 milligrams, 10 milligrams, 20 milligrams of CBD on a day, and there's the guidelines saying no more than 70 milligrams of CBD daily on a food supplement. So why have we got these discrepancies, and how can we understand it better?
So there's lots of things to say there. I'm not sure in which order to attack it, but so one of the things is that people have been looking at the therapeutic potential of cannabidiol for maybe kind of 15 years or so in preclinical and clinical research. That, well precedes the over-the-counter world. The over-the-counter cannabidiol world came about kind of independently of the whole, group of people who were looking at CBD being used as a medicine. And the dosing is different. I guess one reason is because over-the-counter products are not trying to treat an ailment. They are health supplements. They are not and cannot say that their product will, reduce pain or, improve sleep. They can only advertise themselves as health supplements. And so there isn't really an awful lot of research really out there about over-the-counter type dosing, because in the therapeutic world, we have an idea. In order to change a symptom or, the pathology of a disease, we kind of know how much drug we need to get into a body in order for that to happen. That we've been doing that for a long time. But people haven't been researching these much smaller doses of CBD and what impact they have on biology. So because the over-the-counter world kind of sprang up by itself without, not off the back of a scientific literature, there is a bit of a disconnect between what we know about CBD from the preclinical and clinical world and what is available over the counter. There aren't people funding that kind of low dose CBD studies because the companies themselves can't make medical claims, so they don't want to do research, nor do they really have the funding because that kind of research is really expensive. So I can't see who is doing that funding out there to look at what regular, very low. I would consider the doses to be really quite low in terms of, you wouldn't be using them in a therapeutic world at that kind of dosing. But who knows? We just don't know what the biological impact is of taking these things regularly over time because it's not been researched yet. And I hope that research will come. But what we do know about is the other side of things, which is the more kind of immediate medical world. And the 70 milligrams a day thing is something that, again, was imposed really. It's difficult to tell where they came up with that number from. I mean, and I'm not a toxicologist, but
it wasn't based on toxicology. It wasn't based on toxicology.
Yeah. So it is I find it a bit arbitrary because we know that people consume far greater doses of that. I mean, if you are a patient with epilepsy, you could be taking a gram of Epidiolex a day, or you could be taking, up to a gram of CBD a day, which is clearly an awful lot far away from 70 milligrams. But, you have to think about this risk health always whenever you're looking at any medicine is, what is the risk to my health? What is the benefit to my health? And in people where there is a known disease or disorder, it's easy to make that decision in your head, the risk of having potentially fatal seizures versus the risk of taking a medicine over a long time. I think they're being quite cautious in the over-the-counter world in thinking that there could be a risk that we're not aware of yet with chronic use. And therefore, they've put quite a low daily allowance on CBD in what is effectively a non-medical arena. So if you're not taking it to treat a medical condition, then your risk-benefit conversation is going to be kind of different, because if you're saying there isn't really something wrong with you, is the risk of then potentially taking something which isn't going to be doing you any benefit, then, do we have to take a much lower risk on that? So it's still a difficult one to understand where 70 milligrams comes from. I do think it's probably very low. Yeah. So one of the other things that we probably didn't talk about in terms of differences between over-the-counter medicine and prescription medicine is about knowing exactly what's in your CBD. And I think one of the questions that came up was about, how do you know the difference between what's out there? Prescribed CBDs are very regulated. They have to be made to be fit for human consumption. We have to know exactly what's in them. You have to know the exact percentage, the amount of CBD, and exactly what anything else is in the formulation or the preparation of that CBD. Whereas the over-the-counter market is really less regulated in terms of, there's no legality on these things being what they say they are. And when I was working with the Centre for Medicinal Cannabis, must be 2 years ago now, we did a kind of a mystery shopping study where we took 30 over-the-counter products and we independently tested them for their cannabinoid content. And it was very interesting to see that there was quite a broad range of CBD contents in these products, and only a third of the products actually had the amount of CBD that they said they had in them. And some of them had no CBD at all in them. It was just olive oil. So, it's an unregulated world, the over-the-counter is. We also found that there was THC in at least half of the products that we tested. There's other non-disclosed chemicals in these products as well, because they're not regulated. So I think that's something that we didn't mention, but just has come up in my head that we should flag up as well. That the prescribed CBD products are far more regulated.
Mm-hmm. No, absolutely. And this is why, people, shouldn't self-prescribe and should be, seeking the professional, the medical advice to get the right products, to match to their what they're looking for the therapeutic benefits for their conditions. So yeah, I think that's great. Saoirse is sort of really beginning to understand the differences between these products and how people are taking them. And I know that you mentioned when CBD gets into the body, it's then certainly via oral route in particular that there's something called first pass metabolism. It's where the liver then gets involved. So I was just wondering then to sort of move the conversation into any other sort of drug interactions with CBD, because obviously the liver is very important for breaking down a whole host of, as you said, chemicals, toxins, drugs as well, other medications. So what about CBD and other medications in terms of a drug interaction?
Yeah, so this is something that we do know quite well about CBD, particularly because of all of the epilepsy trials that have been done. And this is one of the important parts of, the more traditional drug discovery routes. When you do all this kind of pharmacovigilance, which is keeping an eye on the safety and side effects of drugs, is you start seeing things that you wouldn't have maybe realized. And one of the things they noticed in patients who were taking their normal anti-epileptic medications were that they were seeing some side effects that were probably ascribed to the anti-epileptic medication rather than the CBD, as in it was a side effect that they were probably expecting to see but was suddenly coming up worse. And that made them wonder whether or not the metabolism of those anti-epileptic drugs was being affected by CBD. And effectively what they found is that it was. cut to the chase. So most medicines, as you said, are broken down within the liver, and there are lots of different, slightly different enzymes that break down different drugs, and every drug we will know how it's broken down. And it turns out that CBD inhibits a couple of enzymes in the liver, a couple of quite key enzymes that are known to break down other drugs. And so it came up in the epilepsy world because they were monitoring for this, and CBD inhibits a couple of the enzymes in the liver that normally break down anti-epileptic drugs. So what that meant is that because the metabolism was being inhibited, it meant that those drugs were being around for longer and potentially at higher levels than you would want in these patients. So you were getting more, what we're trying to do with CBD, which is increase the bioavailability, you were getting more drug exposure. So what they had to do is bring down the doses in some of those anti-epileptic drugs in order that they didn't have too much drug exposure and too much blood exposure to the drugs. And so I guess in some ways it's quite fortunate that a lot of the CBD research was done in an arena where the medication is known to be affected by that enzyme, because it highlighted it very quickly to the medical world that this was a potential DDI. And we are seeing now other DDIs drug interactions coming up with other medicines. So for example, warfarin is another medicine that there is a lot of case reports coming out of people on either THC or CBD coming in where their warfarin is working too well. So it's the same problem. They basically, CBD or THC is inhibiting the enzyme that normally breaks down warfarin, and therefore there's more warfarin in the system, which is causing side effects. So, excessive bleeding or whatever. So in a lot of cases, too much of your drug can be just as bad as too little of your drug. And so it's important that you watch out for drug interactions with CBD. I think as more people in different types of disease situations on broader range of medications are using CBD, we need to keep an eye on, are we seeing side effects in those patients that are either due to their CBD or due to the fact that CBD is interacting with their other medications, causing them to have too high levels. And there are a number of drugs that we're keeping an eye on where that is happening with CBD. So it's definitely worth mentioning. And this is another reason why you don't necessarily want to be self-medicating if you have a serious medical condition with multiple drugs. Yeah, because your provider needs to know what potential interactions are going to be going on there. That's what happens when they prescribe any new drug. They'll look at the profile of what you're already on and whether or not those interactions might occur.
Exactly. Well, thank you for that. So I was going to say exactly that, another reason for working with medical providers, medical clinics, especially around, the relatively new area of medical cannabis and interactions, as you mentioned at the beginning, we're really only looking in the last sort of 30 to 50 years of sort of understanding of what's going on with cannabinoids.
People won't have been thinking about this because they could have been putting down those side effects to the cannabis medicine, rather than thinking actually it's what I'm already on that I'm getting a bigger than normal side effect because I've got increased plasma exposure. So that's another thing another reason to really keep an eye on this, is because we don't want, the cannabis-based medicines getting too bad a rep and being, a lot of side effects being put down to them that actually might be due to other things. And there was a really interesting meta-analysis, which is where you look at clinical trial data from lots of different clinical trial data, and you put it all together and really kind of big picture look at some things. And when they excluded all of the patients who were on anti-epileptics, and this paper was particularly looking at the side effect profile of CBD, and when they took away all of the epilepsy patients who were on anti-epileptic medications, the side effect profile was far less severe when it was just patients just on CBD medications. So they were saying that a lot of the side effects that are seen to CBD are really because of their concomitant medications rather than the CBD itself. So there were some things that stood out. So GI disturbances, particularly diarrhea, and I think maybe some weight loss as well that stood out in the CBD alone patients. But a lot of the more severe side effects were coming from the anti-epileptic medications.
That's really interesting. And actually, I would refer people back to our very first webinar that we ran in this series, where I talked to two medical cannabis patients, Andy and Caroline, and they talked a bit around, sort of side effects and how they managed that and got their dosing right with their doctor to manage. But equally, as you said, we need to make sure that it's not just attributed to medical cannabis or to the CBD, medically prescribed CBD products as well. And really just to allay any sort of fears or concerns, you can take the medically prescribed CBD, medical cannabis, alongside other medications. It's just that's where, as Saoirse said, you work with your provider, with your healthcare doctor, to make sure that you get the right balance. So the two can be taken together. So yeah.
And the really nice thing is that most of the time so far in all the drug interactions, what's happening is you're reducing your dose of your other medications. And patients like that. And in some trials, people are keeping an eye on what's happening to the other medications that the now medicinal cannabis patients are using. And I've seen trials in IBD where most of the other medications that they're taking, they're either completely reducing their dose or completely stopping the drug, and there's nice data coming out in terms of opioid sparing, and this interaction, it's not just an interaction with opioids, but it's a synergy. So there is a synergistic interaction between THC and opioids where you can have the same kind of pain relief, but with much lower doses of opioids.
Yeah.
So this concept of drug sparing with medicinal cannabis is, I think, an unsung benefit of medicinal cannabis.
Yeah, no, absolutely. Again, I mean, you're raising several points. So IBD is just for people as inflammatory bowel disorders. No, that's fine. Just for the studies that we were referring to there. But just to pick up on your points, I mean, I do quite a lot of work around medical cannabis in TBIs or traumatic brain injuries, especially around contact sports, and so I do a lot of work around in the States and medical cannabis, and as you say, that sort of reduction in opiates as well is of a huge benefit, because we know that the side effects of a lot of medications, including the opiate, the painkiller products that are used, can really be very dramatic. So to be able to reduce that medication, or in some cases studies showing coming off medications, switching into using medicinal cannabis is only really going to provide huge benefits. So yes, I like that. It's definitely an unsung sort of important point. So so you mentioned there as well around sort of CBD and THC kind of working together potentially, or and this is kind of all wrapped up as well in what we hear as the entourage effect. So I wonder if you could give us your take on the entourage effect. And we've had some specific questions around CBD and THC working together. So maybe if we just sort of start again at the entourage effect, and then we could have a look at the other sides.
Yeah, so it is a really nice link, because to me, as a pharmacologist, the entourage hypothesis, which is what I call it, because I don't think it has been proven to be an effect yet. So the entourage hypothesis is really just about drug interactions. It's about saying, if I take multiple cannabinoids at the same time, are they interacting with each other in a positive way? It's just another type of drug-drug interaction. And there's really two levels at which this can be happening. So it can either be happening at a receptor level, so at a cellular level. Is there an interaction between those drugs at a cellular level that makes them work better together than individually? And we know with THC and opioids that's true, because the cannabinoid receptor and the opioid receptor are found together on the cell membrane, and they work synergistically together. When they're both activated at the same time, there is an enhanced effect compared to either receptor being activated by themselves. So that is a known kind of drug interaction at a cell level. And then you can also have an interaction at the whole body level, which is more that interaction we were just talking about, where one drug tends to inhibit the metabolism of another, either inhibiting it or promoting it, so then the drug gets cleared quicker. Wow, it's snowing in Nottingham.
Oh. Oh.
Wow. Okay, sorry. So the entourage hypothesis is this concept: when you take a whole plant product, be that a broad extract or a full extract, or it could just be, a blend of 3 or 4 of your favorite kind of phytocannabinoids, do they work better together than any of the pure compounds on their own? Now, I'm a real keen follower of this research area, and I've been keeping track of all of the kind of papers out there that suggest that yes, there is an enhanced effect when you take them all together. No, there isn't an enhanced effect when you take them together, or there is no difference. So they are equally good whether they're on their own or in an what we call enriched extract. So an enriched extract means more than one phytocannabinoid there. And basically, the three columns are fairly similar in size. So there is almost an equal amount of studies that suggest there is a benefit, isn't a benefit, or they're just as good if you take them separately or together. And I think it's probably going to be very disease context specific. So I think in some conditions, it may be that a mixture of phytocannabinoids will have additive or synergistic effects, either at that cell level, because multiple of the, more than one of the chemicals are interacting with the receptors, either the same receptor or receptors that act cooperatively with each other, or more likely is because they are competing with each other for liver metabolism. And so you're going to have a reduced metabolism of some of the key, what we would call active pharmaceutical ingredients. Now, if that was a CBD enriched product, your main active ingredient is going to be your CBD. So if all of the other entourage chemicals are just blocking the metabolism of CBD, then of course you're going to get a greater effect. You're going to have superiority of that product, but it's going to be just because you've got more CBD there, rather than a biological contribution of some of the other components. I hope that makes sense. Now, the people have their favorites. People, definitely will say that they like one more than another. But when it comes to, it's really, really raining out, like bizarre. When it comes to kind of controlled literature in this area, we really have very few studies to go on. But there was one great study that was done, published from Israel about 2 years ago, a year and a half ago. And this is an autism trial. And they have a 20-to-1 product that they find effective in autism. So it's a ratio of 20-to-1 CBD to THC. And they did a randomized control study where they looked at this 20-to-1 ratio of just pure chemicals, so pure CBD and pure THC, or an enriched extract where it was 20-to-1, but it had all other, phytochemicals present. And they didn't find any superiority no significant difference between the extract ratio and the pure ratio. So that, for me, when it comes to kind of, hard evidence, you want that kind of randomized controlled data. And so far, that wasn't, and maybe that's just autism, maybe it's just particularly the endpoints they measured, but in that arena, there was not superiority of an enriched extract over just the pure, what I would call active ingredients of the plant. So I think the jury is still out. I think if you personally find one product better for you, then great. But in terms of kind of having that kind of bigger evidence base about which is better and in which conditions, I think we still have a lot of research to do.
Yeah, absolutely. And you said sort of right back at the beginning in your fantastic explanation of CBD and how it interacts in the body, that CBD is working in a different way to THC. So by combining the CBD and the THC, in identified ratios within medications, you said either in that study or something like Sativex, which has the 1-to-1 ratio of THC CBD, the two phytocannabinoids are going to be working in kind of different ways within the body as well. They're not added together to create a synergistic effect, really, are they? So.
Yeah, and this is where I always struggle when people talk about entourage. Are they including something like just a ratio? Like Sativex is slightly different because there is quite a lot of other in Sativex. So I think there is 10% of like other chemicals. So in some ways it is an enriched 1-to-1 product. It's not just purified CBD, like 99% purified CBD and 99% THC. So, but yeah, would you consider that to be entourage if you're just blending together two pure compounds, or do you have to have multiple compounds there, or if you had 3 compounds, So I think that concept of where entourage begins and ends. So some people will be, whole plant advocates where they say you've got to have everything there. Whereas others will say, well, actually, THC, just a 1-to-1 ratio, and there is literature to support this, is beneficial than either compound on their own. And that's in multiple. So in pain, in nausea suppression, there's quite a few arenas where a 1-to-1 CBD THC product has been shown to be superior to either alone. But in my head, that's not an entourage. That's just two compounds working together. So I guess I guess where you draw the line of what you consider to be entourage or not. But in my head, people are talking about all of the other phytochemicals, which includes terpenes and flavonoids and all the other lovely things that a plant makes that could be adding to the therapeutic benefit of the plant as well. But from a pharmacology perspective, the quantities of most of those other chemicals in any kind of preparation are really quite low. And if you kind of translate that to then only 10% of that is getting into your body, then the actual amount of any of those chemicals circulating in your body is probably not at a level sufficient enough to be engaging with all of the targets in our body that we know have to be activating to get a therapeutic beneficial effect. So it's difficult to know how some of these much kind of smaller quantity chemicals can be combining to the biological effect. In my head.
Yeah, no, absolutely. And I think we've had questions around, should people be combining THC and CBD for pain conditions and things? And you've explained that really clearly. I mean, first of all, work with your doctor and find the product that's working for you. They will know the indications for. But that yes, there can be that combined effect, and whether we call that strictly an entourage effect or whether it's actually just because they're both biologically active. But the two phytocannabinoids are working together. So I can see we just have a couple more minutes, but there's a very interesting question that I'd like to just sort of end on with your sort of thoughts around risk of tolerance with CBD in particular, because again, we do kind of, get this, if I keep taking a product, a natural plant-based product, am I just going to get used to it? Will I keep having to take more and more? So I just wondered whether you had any thoughts around, tolerance of phytocannabinoids within the body.
So tolerance we understand a lot better when it comes to THC, and THC activates this CB1 receptor, which is on the outside of a cell membrane. Now that receptor, when it gets activated too much, hides. So it goes intracellular, it moves away from the cell membrane and it goes intracellular. And so tolerance does develop, and that's quite well known in the recreational space. I think what's less well known is how that translates into the medicinal space, because I know in studies where people have tracked how much medical cannabis is prescribed over time in the same patient, they're not seeing that patients are requiring more and more of the same product over time, which is what would give you an indication that tolerance is developing. Therefore, you need more and more drug to overcome that tolerance. But I think in studies where they've looked at that over time, they're not seeing that patients are using more and more. So it doesn't look like there is tolerance developing, and tolerance will always be dose dependent. So if you're using loads and loads of THC, then that receptor is going to hide and you're going to get, but there is a point at which it's not going to hide. And I think maybe in the medicinal space, people are not using so much that tolerance is developing. But I don't know what a clinical experience would be about that. But I know that's what data that I've seen doesn't seem to suggest that people are using more and more over time. CBD, there's not much data on tolerance. I know the long-term data that's come out with Epidiolex, because obviously they're continuing to monitor those patients over time, and they're still doing really well and still having, really good seizure control. So again, it's not looking like that either the efficacy is waning or that the drug requirements are increasing. So I don't think that we're seeing signs of tolerance developing there either. But I don't know whether you have a different perspective on that or not.
No. I mean, I think, my take on CBD is very little tolerance because of the mechanism of action within the body, and also that there is a ceiling therapeutic benefit as well, a ceiling level. It's not just a case of taking more and more and more and you'll see better and better effects. The body gets to a stage where CBD is kind of working. And I think because CBD is, you say, it's not directly interacting at receptors, it's more blocking enzymes and breakdown of the body's natural endocannabinoids, which we've not really talked about. That's a whole
other 2 hours.
I know, that's another webinar, isn't it? The endocannabinoid system. So because CBD has a different mechanism of action, it has a very different sort of ceiling benefits and effects. So I can see. I mean, already at
it's already 1 o'clock.
How quickly does an hour go by? We've fantastic questions. I'm sorry we haven't been able to answer them all, but hopefully, having had a look through them, we've kind of covered a lot of the areas with the content, the fantastic content that Saoirse has provided us with today. So again, I think really just to summarize, do see your medical provider, your doctor, to get the right product. We've really outlined today the benefits of looking at medically prescribed CBD, because we know what's in the product and the dosing ratios as well. And also to remind you that we do have webinars in the previous webinars in the series that might answer some of your questions more specifically around the patient side and patient access around these products, and also around the sort of the medical cannabis research side more specifically as well. So do check out the Sapphire Institute, and hopefully join us on the March the 17th as well with Wendy Holden. There is also a webinar. Yes, oh, of course, yeah. There's also a webinar next week on the 1st of March, all around medicinal cannabis use in pain. So do take a look at the Sapphire Institute webinar website to sign up for that webinar as well if you're interested. So Saoirse, thank you so much for your time, for your wealth of knowledge as well. I mean, you really have provided us with some fantastic information and knowledge all around CBD, but the practical side as well of how to look about taking products and getting the best out of them as well. So thank you so much for your time, and we look forward to you all joining us on the next Sapphire Institute webinar very soon, and this recording will be available for you all to view at a later date as well. So have a great day, everybody. Thank you very much, Saoirse.
Thank you. It's been a pleasure. It really
Wonderful.
has.
Wonderful. And we'll see you all soon. Thanks then.
Thank you. Bye.
Bye.